Hello, Adam, in Edinburgh.
Hi
Hopefully,
everyone, how are we doing?
we're good, Adam. How are you today?
I'm good, thank you, I'm good.
Good. Delighted to see you. Adam, first of all safe and well in your side of the country in Edinburgh?
It is, yeah, it's slightly, it's kind of like an old movie set. You sort of walk around and it's very sort of dystopian-like, aside from the meadows where I think half of Edinburgh have decided that they're all now runners. So apart from the meadows, I think everywhere is pretty quiet. But I think the message after the proper lockdown that was announced last week, I think that's now really had an impact, because before then it was some people were doing it and others weren't, but I think there's a lot more sort of adherence to these guidelines and advice now from the government, which is good to see.
Good. Adam, just take a wee moment to introduce yourself and introduce the business, our SBN member today, please.
Sure. So, as I say, my name's Adam Hunter. I'm the Chief Commercial Officer of Phlo Digital Pharmacy. We're a real-time delivery pharmacy service. It's a bit like we're kind of like the Deliveroo of pharmacy, but we also own the kitchen. My background is slightly different from pharmacy. I don't have any background at all in pharmacy. I was a corporate lawyer for a period of time. I then went to the US and studied at Babson College in Boston. And it was during that time I made the pivot away from sort of corporate legal M&A advice to working in businesses. I then joined a craft distillery called Ardbeke Highlands Estate and grew that company from one product to a global exporting powerhouse, certainly in Scottish craft distilling. And then in 2019, I joined a good friend of mine called Nadeem Sarwar, who is the founder of Phlo Digital Pharmacy. And we had met together at Babson College when we were both studying something called the Saltire Foundation Fellowship Programme, which is a part of the Entrepreneurial Scotland network. And it was from there I am now in the midst of a tech company delivering pharmacy or delivering prescriptions.
Sorry, the company is a Scottish-based company, Adam.
Yeah, so we have a slightly nuanced setup. So our headquarters are in Glasgow, and that's primarily from an engineering and commercial side of things. Our operational base is actually in London. I think we're the only pharmacy in the UK based out of a shipping container in Hackney. So our pharmacy team is based primarily in London. So we're split between the two cities. And before the lockdown, I would split my time between Glasgow and London. I'd be in London 2 or 3 times, or for 2 or 3 days every second week. So although we're a Scottish headquartered business, very much our focus is on London.
So can you tell me the story of how and why Phlo Pharmacy came about, Adam?
Yeah, absolutely. So it started actually at Babson College. If anybody has never come across Babson College, I'd highly recommend checking them out. I think they're the world leaders in entrepreneurial thought and action. They have a saying at the university called being comfortable, being uncomfortable. And I think they try and get that mantra into all of their students that come through their doors. And I think that education for me has served me very well, not only before, but certainly now when we live in these very uncertain times. And I echo Sandy's point regarding opportunities where uncertainty does come. If you look back to 2008, Airbnb started at the height of the financial crisis because hotels were collapsing, but people still wanted to travel. So there are always opportunities in times of need. How Phlo started, really, we went, myself and Nadeem and part of the wider cohort went to a design thinking company called IDEO based in Boston. And they were working with a very, not even launched yet at that point, a company called PillPack in the US. And they were very much a whiteboard company, and their idea was that the pharmacy sector in the US was broken. You were going long queues, no drugs. There was a disconnect between what the insurance companies would pay for and what the pharmacies would give you in terms of prescriptions. So IDEO came up with a sort of design thinking approach to basically online delivery through the mail. That was then, just for a bit of background, PillPack was acquired by Amazon in the US, I think it was last year, for about $750 million. And Nadeem, as a type 1 diabetic, thought, you know what, there's nothing like that in the UK. We have the exact same problems, i.e. a broken pharmacy system that doesn't really work for the patient, it doesn't really work for the supply chain, doesn't really work for the NHS. Can tech provide a solution here and make access to medication easier and adherence to prescriptions also more effective? So he came back, and it was quite clear that he needed a pharmacy license. So Nadeem, his background was in banking. He bought a pharmacy in Norfolk. It was a loss-making pharmacy who dealt purely with care homes. So all original pack dispensing. So what that means is separating all the drugs into Monday through to Sunday for each patient who lived in the care home. And he grew that business, turned it around, grew it into the largest pharmacy care home provider in Norfolk. And during that time, he thought, right, I can use the license here and then learn about pharmacy and the nuances of pharmacy. And I won't go too much into that detail, but it's not a particularly straightforward sector to operate, as I'm sure Sandy can echo from a manufacturing point of view. So it was during that time that we started to look at the business. And in effect, Nadeem thought, right, I'm just going to copy PillPack and bring it to the UK. However, like any good business, he started talking to patients and some potential patients. And just to give a bit of clarity, the total value of the UK pharmacy market, just in the NHS, so not private prescriptions, is about 12 billion in terms of revenue every year. Only 0.8% of that 12 billion is made up by online pharmacy. And from our research, it was quite clear one of the reasons for that was people were uncomfortable with having their medication through the post. One, couldn't really track it. Two, although the Royal Mail do their best to deliver, doesn't always happen. And there was just that lack of effectively a point of contact. So it was quite clear that maybe the PillPack model wouldn't work as easily as Nadeem had thought. So effectively, we did a slight pivot in the business and said, actually, what people are looking for is a hyper-local infrastructure with real-time delivery of NHS and private prescriptions. So going back to my earlier thing of we are the delivery of pharmacy, it's really as simple as that. You log on to our application, you can go onto our website, weareflo.com, and sign up. And then through that, it's basically your medical records and your prescriptions, whether that's your repeat prescriptions or your acute prescriptions. You can then select a time and a place for that to be delivered in. We do it in 4-hour slots. However, our average delivery time is about 2 hours. But I like to under-promise and over-deliver on that front. So we'll keep it at 4 for the moment. And then you get real-time tracking all the way through. So as soon as you've placed your order, much like in a Deliveroo where you see the icons coming up with them cooking food, we do something a little bit different, but it's the exact same concept in that every stage of the journey for the patient, they know exactly what's happening, when their prescription is going to arrive. As soon as it's been picked up by our courier partner, it's much like an Uber or Deliveroo. You can track that car all the way through to your location. You can live chat with the courier driver. So say, for example, you were supposed to get it delivered in, I don't know, Clapham, but now you're in Canary Wharf, then you can change the order and they'll then reroute it to that location. So really that was one element of our model, and really what that will be is a hub and spoke model. So at the moment, as I say, we've got this shipping container. Reason for that is that they're really, really cheap, and actually the length of them make them far better than a standalone commercial unit on a high street. They're also safer in terms of our security, etc. So effectively what we will do though is we build out, we'll have a central distribution hub somewhere in London, and then we'll have minor spokes that cover out the different pockets of London. Because really London, you can't treat it as one market. You have to treat it maybe 4, 5, 6, 7 markets. And then you have to be aware of the transient nature of the population. So they might work in London, but they could quite easily live in Brighton, Essex, or whatever. So that's really the kind of where we are with the kind of prescription side of things. We then sort of, and this was partly by chance, partly by design, but we built our pharmacy tech in a modular fashion with open APIs. So without getting too technical, what that means is that other companies can easily plug into the pharmacy tech that we have built. Now, going back to the patient experience of pharmacy going to a community pharmacy is broken. And a lot of these pharmacies are trying to pivot, but the problem is that once you've built legacy systems, it's very hard to then change that and change it in a way that is quick and then reliant with market demand. So when we built the pharmacy, we built the patient at the heart of everything we do. And our laser focus is on patient safety, convenience, great design with great user experience. So
Sure.
it's allowed people to go, you know what, accessing your medication doesn't have to be difficult. You can use this on your phone. People are already doing it for food. They're already doing it for, with your Amazons and your Ubers and the like. So this is just another part of giving the patient an option to still have access to the medication, but then get on with their lives.
Yeah.
So the AWS, we've either called this the AWS of pharmacy, and it's actually probably a completely different business from what we're doing, but at the moment it's kind of under the one umbrella. And our idea there is to provide this tech infrastructure to other pharmacies in markets that we may not want to operate in, but they still have this demand for this real-time delivery model. And we should have probably by the end of the summer 4 or 5 health companies that we will be their fulfillment partner moving forward, which gives us on a purely Machiavellian point of view, gives us a diverse revenue stream.
Okay, so just to clarify then, Adam, because of the electronic prescription service which exists here in England,
yes,
you are able to offer this online delivery service, both in a timed allocation in London, where you set up the prototype for this, and in an overnight service through Royal Mail to anybody else throughout England. And it's purely because of the electronic prescription service, which does not currently exist in Scotland, that you're concentrating in that market. Is that correct?
Yeah, I mean, it's a mixture of the two. So we do have the electronic prescription service in Scotland. It's just a different variant of what the English NHS. So just to explain it, the NHS is not a singular organisation. It's broken up into the regions, and that's pre-devolution. It's always been like that. You've had NHS Scotland with its particular challenges, NHS England, etc. So when the electronic prescription service was implemented, Scotland actually did it before England, but they chose a particular way of doing it. That was on the basis of advice from existing pharmacists and also the political decision made by the government at the time. And then in England, they went probably for a more comprehensive EPS system. So at the moment, our technical or the systems we need from the NHS side of things, because effectively what we do is we hook into the NHS spine because we're an authorised NHS pharmacy. It means that we have access to people's medical records, etc. And for our systems to work, it only works really with the English system, so we can effectively grab the data that is relevant or pertinent to that patient and drag it out and put it through into the application. We can't do that in Scotland. I wish we could. But at the moment, our focus is on London. And also, furthermore, if you look at density of population, real-time delivery, if you're going to scale that, you need a density of population because you need people all kind of quite close to each other, so it makes the economics of delivery feasible. So London was the obvious choice to do that, and also London too is an early adopter of tech. So if you look at any tech company that's launched in the UK over the past 10 years, I'll bet my house that they launched in London, whether that's Uber, Deliveroo, all of the likes. They will go to London first because London historically adopts tech earlier than probably the rest of the United Kingdom. So we felt, look, if we can nail this in London, create a brand in London and scale our business, it then provides us with the base to then scale that out across at least England and hopefully at some point to other parts of the United Kingdom.
But just to clarify, that the London scaling that you're doing, Adam, is the day on that day and time delivery.
Yeah, that's that real-time delivery piece, which no other pharmacy in the UK can do. No other pharmacy can deliver the way that we do and offer the way we do. No other online pharmacy. Online pharmacies, when you do the mail, is very good for your repeat prescriptions because you get it every month. It's the same drug. It's usually the same quantity. Acute prescriptions, which are these one-offs, so you might have, chest infection, a skin rash, something that you might need 6 weeks of antibiotics, but that's it after that. That doesn't really work because you need that instantly. You can't wait for 3 or 4 days to get that in the Royal Mail. So by offering a one-stop shop, and it's another reason why patients didn't want to go to online pharmacy purely because they couldn't do the full offering. So they could do your repeats, and that's great. But as soon as you've nominated an online pharmacy, if you then go to a community pharmacy to pick up your acute prescription or your one-off, you then have to get them to change the nomination back to the community pharmacy. So that's a little bit snagging there, but what you have with Phlo is a one-stop shop in terms of if you sign up for Phlo, as long as you have a registered doctor in England. So for example, we have patients at the moment who were living in London, but after the lockdown decided to get out of London and have moved back to their parents in Scotland or their family members in Scotland. They're still getting their prescriptions because they're still registered in London, and they still have an English registered GP. And all we're doing now is not doing real-time delivery, but we're sending them the Royal Mail. So it can do UK, but if you are in Scotland, you need to have an English.
English. And I'm very conscious of time at the moment for everybody here. So what is your laser-focused ask of the SBN community and wider at this time, Adam?
Yeah, I mean, I'll tie in the ask as well, just in relation to COVID-19. COVID-19 was obviously unexpected. However, you won't be surprised to hear that Phlo is uniquely set up to help with the access of medication whilst people are on lockdown. You've got community pharmacies with one in, one out, lots of queues, and especially vulnerable people not being able to access their medication. Our ask is really simple. We're a startup business. We've been live operationally for about 6-7 months, and we really don't have the marketing budget to compete with the multinational pharmacies who can drown out the noise of everyone else. But these multinational pharmacies aren't really set up for the delivery mechanism that is required in this current phase. We're not charging for this service. We're not profiteering from this service. This service is the same service we offered 6-7 months ago. There's always a free delivery option, whether that's your real-time delivery piece or your Royal Mail option. And really my ask is simple. Please spread the word. If you spread the word within your network, spread the word within your friends and family, anybody who is looking or is worried about accessing their medication during these uncertain times, if we can at least address that small little problem, it allows people to get on with their lives and try and resolve to one normality. And I'll give one very brief story, Christine, and then I'll get off. There was a really interesting point last week. We had a family phoned up. They were both in self-isolation. They had a very young child who had very chronic asthma. Now, if a young child has a proper asthma attack, it's into intensive care. They couldn't get out to the pharmacy to get their inhalers, and they couldn't get anyone to deliver. They contacted us at 10 in the morning, and by 3 in the afternoon, their child had their inhalers. Now, that was a nice thing for us to see because that's why we set up this business, but also for that family as well. It was one less challenge to overcome that day, and they could live to fight another day. So this service is one that can really help people adhere to government social distancing and the lockdown provisions and help stem this spread of the virus around the UK. Thank you.
So a very clear ask, spread the word. And an important point you said there at the start there, you're not exploiting this situation. You have a service to provide. Unfortunately, at the moment, it is only available in England, but they have the technology there who are supporting those who are vulnerable and in need during this time and adhering to all government requirements. So very clear ask for those of us in the South, sign up. And for others that we can spread the word within your communities and wider about this service being offered. Adam, thank you so much. I don't have any questions coming in at the moment, but if anybody wants to discuss this with you and some ideas, and I know that happens regularly at within SBN events, I know there's a lot of discussions happen offline, so very happy to make that connection. And I've already had a quickly in there from Sandy in the USA, very keen to connect and have a discussion with you around the business. So again, we'll make that connection.
Anybody who would like to connect, then please, LinkedIn, Twitter, etc. I have to Jamie's point. I worked for Arbiki for nearly 5 years. I'm well versed in how to do that side of the business as well. I'm not just a tech person, so anything I can do to help anybody on this call, be it to the wider network, the Entrepreneurial Scotland Network, SBN, then please do reach out.
Thank you. Thank you, Adam. Got a number of comments coming in there, folk very keen to help you spread that word and connect, Adam, so we will follow up directly. So thank you, Adam. Thank you to everybody. If there's anything else that we can do, anything we're not doing now that you think we should be doing, please just let us know. And in the meantime, thank you for your time. I look forward to speaking with you all next week. Thanks one and all. That's me. Take care, everyone. See you next week.